Hello everyone, I'm Ashish Pandey from First Pavlov Medical University of St. Petersburg, and today I'm going to talk in this video presentation about pneumonia in the children, also called pediatric pneumonia. So actually, what is pneumonia? Pneumonia is an infection in one or both of the lungs and is sometimes called chest infection. Pneumonia in children can be caused by virus or bacteria, and because of the infection, what actually happens is the small airways in the lungs become swollen and make more mucus sticky fluid. The mucus blocks the airways and reduces the amount of oxygen that is able to get inside your body. So pneumonia often comes after another respiratory infection such as cold. Sometimes there may be complications associated with pneumonia, but these are not very common, and your doctor will monitor your child for this condition and prescribe for the possible medication. Moving forward to the next slide, what are the possible causes of pneumonia in your child? So pneumonia is most often caused by bacteria or virus, as I said earlier. Some of these bacteria and virus can be spread by direct contact with a person who already is infected with them. Viruses are common cause of pneumonia in younger children or infant. The most common viral cause is usually RSV virus or influenza virus type A and B. The most common bacterial cause is a type of bacteria called Streptococcus pneumoniae. Now, which children are at the risk for pneumonia? A child is more likely to get pneumonia if he or she has weak immune system and ongoing cancer treatment or chronic health conditions such as asthma or cystic fibrosis. Problems with the lungs or airways may be other tuberculosis and other kind of diseases. In addition to this, children younger than 1 year old are at risk if they are around second-hand tobacco smoker. This is especially true if their mothers smoke. So the mother who smoke, their child have higher risks of getting pneumonia in the future. What are the symptoms of pneumonia in children? So we divide this into three different groups: babies, newborn babies, and babies under 1 month. We see the mom can notice that her child, newborn baby, has struggled to breathe. There may be grunting or moving their head up and down with breath, drawing the muscles under their chest in which they breathe, so it looks like they are breathing with their tummies. So breathing fast, stop breathing, these are the possible symptoms which the mother can notice. And also the feeding, they are not eating or feeding properly. No wet nappies for more than 12 hours or more, and we can even see fever or temperature that goes up and down, a lot of irritability and sleeping badly syndrome, and in some children we can see the blue skin inside the lips of or under the tongues as always. Now if you see the babies over 1 month old, we have of course these symptoms as I mentioned above, but also we might see cough a lot, although the cough can be very soft and have difficulty breathing and draw the muscles up and down, and while breathing the child make very wheezy sound. Now toddlers and older children may also complain of pain in their chest or tummy, and when they vomit and they usually vomit after having cough. Usually they refuse to eat and drink. So if the mother has to be really careful about these symptoms in their child and need to consult doctors as soon as possible. Moving to the next slide, how is pneumonia diagnosed? Usually your doctors can diagnose pneumonia just by the history you explain to the doctor, and also by the best way is auscultation. Auscultation in some children, usually we see this wheezy grip sound in the children, and usually on the lower right part of the lungs. So auscultation of the lungs is one of the best way. However, there are no other facility of X-ray or other different tests. Apart from this chest X-ray, your doctor might take the chest X-ray of the patient. Blood test, in the blood test in bacterial pneumonia we see the elevated WBC, also sputum culture, and for the differential diagnosis we can even use chest CT scan or pleural fluid culture. Moving to the next slide, how is pneumonia treated in children? Treatment depends upon the causes of pneumonia, of course. If the bacterial, then children are given antibiotics either in tablet or in liquid form, and usually the condition improve in 48 hours, but they might they might have this cough for a longer period of time. We need to understand that even the condition of the child improved in 48 hours, we need to complete the course of antibiotic. Usually antibiotic of beta lactamate group, amoxicillin, is given for the bacterial pneumonia, and it is usually given 3 to 7 days. So even though you have, if the symptoms, if the condition of the child is improved, you have to take the complete the course of the antibiotic. If the viral infection, if the pneumonia is caused by the virus, then it goes itself in a few days. But in recent days, macrolide is the first line of therapy for the treatment of viral infection, pneumonia. Also, if the condition of the baby goes not good, then oxygen therapy and IV fluid is given if he or she is unable to drink. What are the possible complications of pneumonia? So it can lead to pleural infusion, lung abscess, necrotizing pneumonia, and also sometimes lead to septic condition. How can you take care of your children at home? Taking care of children at home is really important, and mother has to understand some basic idea before looking for doubt. Now, how can we prevent pneumonia? The best way to prevent pneumonia is, of course, vaccination. Vaccination against pneumococcal infection. There are, in worldwide practice, there are usually two different types of vaccine used. It is PCV13 pneumococcal conjugate vaccine. Usually doctors give the vaccine to the children at 2, 4, 6 and 12 through 15 months old, and for the adults who need this vaccine only get a single dose. So the vaccine helps protect against the 13 types of pneumococcal bacteria that mostly cause serious infection in children and adults. And there is another type of vaccine called PPSV23 pneumococcal polysaccharide vaccine. This is given a single dose, and CDC recommends 1 or 2 additional doses for the people with certain chronic medical condition, and these vaccine have been proved very effective. According to the data collected by the CDC, it shows that at least 8 in 10 babies from serious infection called invasive pneumococcal, this vaccine protects from invasive pneumococcal diseases. 75 in 100 adults 65-year-old against invasive pneumococcal diseases. So it has the it has the more chances that you don't get pneumonia in the future. Thank you very much. You keep